RQI for NRP has a lot of untapped potential.
I feel like I get a lot more personal attention this way than I ever did in the classroom setting.
Our institution was part of the beta testing for the RQI platform. Positive pressure ventilation is very important life skill in neonatal resuscitation. About 3 to 6% of babies born require positive pressure ventilation. Globally, about 700,000 babies die due to birth asphyxia. So we believe positive pressure ventilation is the most important life skill in neonatal resuscitation program. How do we achieve mastery over this face mask ventilation skill, which we know is the most important life skill in neonatal resuscitation? And that's where RQI comes in.
One of the systematic reviews that was done at ILCOR was to look at how we educate people in resuscitation. And that review showed that we really need shorter training intervals in between the times that we do our education.
Current teaching method traditionally requires an NRP provider to go to an instructor, practice the face mask ventilation skill every 2 years, which I feel is way too long.
NRP has been trying to incorporate these newer strategies that we could use. And one of them that we have come up with is to try to practice skills on a frequent basis. And that led to our working with RQI on a strategy that we could do for neonatal resuscitation.
One of the things I'm very excited about the RQI for NRP platform is that it will provide us data on how our providers are doing across the entire country with the PPV skills. That data, that feedback, an educator like me or resuscitation experts can take that data and then can use it to make guidelines in a way that implementation of those guidelines will result into better PPV skills, better outcome.
We're starting with that critical skill of positive pressure ventilation, but we imagine that we will be able to also expand that to working on skills like cardiac compressions. So there's just this unmet potential, I think, there that we will get to.
Some of our nursing providers, even the novice providers who have never gone through the RQI or NRP program before, they love it. They feel that this is the type of feedback that can help them get to where they need to be.
A lot of people that I work with who have done this program have really enjoyed it. And I think they realize, they walk into the office and they say, my PPV wasn't as adequate as I thought it was before. So, and they went back and they would try it again and they're like, all right, I got this percentage compared to this percentage. So it's very nice to know instantly if you're ventilating right. So, and I think everybody that has walked in that room that has tried this program has come back saying that same thing.
Our hope is that as more hospitals are utilizing RQI for their learners to continually practice their resuscitation skills, that we will see an impact on improved outcomes in newborns who start out needing resuscitation.
My favorite thing about this program is the immediate feedback that I get.
Having self-directed learning, having this high-frequency, low-dose learning allows them to achieve not only the competence, but confidence